Is manual lymphatic drainage useful for my ongoing treatment? Many clinics are taking MLD away as part of treatment. This is a very common question which unfortunately is difficult to answer. Within many lymphedema services, due to resources, manual lymphatic drainage is one of the treatments that is having reduced resources committed to it. What we know is that there is lack of evidence to support manual lymphatic drainage as part of ongoing treatment programs. It is, however, important that we understand the research surrounding this and therefore apply self-lymphatic drainage treatments appropriately. There is absolutely no doubt that MLD works in most cases. What you'll be aware of is that you've experienced manual lymphatic drainage, is that you've had a change to your skin or reduction of lymphedema, that MLD works. It is always difficult analysing its effects, as it is usually combined with many other treatments, including bandaging or other electrotherapies, meaning that the pure effect of MLD is difficult to ascertain. Add into that there are many variables that can take place from the point that you leave the clinic to getting home to the weeks and months after, that analysing the long-term effects and intervention of manual lymphatic drainage is challenging. Many studies look at the long-term outcomes, meaning that weight gain, reduced activity, wearing older compression, becoming stressed and anxious, or being distracted with life's other incidences taking priority, can all play a consequence as to the long-term outcomes of MLD. Moving forward, I believe that manual lymphatic drainage will be reserved for the clearance at the tops of limbs as opposed to the whole limb, knowing that compression bandaging works fantastically on the limb. It will also be reserved for those tricky areas such as problematic feet and hands, breast edema, head and neck, or bits and pieces. This is what's been recommended in treatment protocols for several years, where understanding NHS resources have been to get the best use of their budgets. In addition, understanding there is a conflicting evidence of manual lymphatic drainage research due to study designs. Compression works really well if it is the right compression, and the job of the skilled hands of the therapists is to ensure that you do not become congested at the root of the limb. From my perspective, if when you have an MLD treatment, you feel a response, the fluid is being moved, and the most important outcome is that you are wearing the correct compression and having the correct dose of treatment to maintain the outcome from your MLD. From my previous questions answered, you are aware that LTA takes a top-heavy intervention for long-term control approach to lymphedema management, therefore meaning that you carry out an intensive phase of treatment in order to get a good reduction initially and not just carry out aimlessly twice a day for life. Then you maintain it, understanding that you have the right dose of treatment input versus the fluid buildup. For many people, this may mean increased activity to encourage lymphatic drainage. Of course, a reduction of or maintaining body weight to take the pressure off the lymphatic system. Wearing good compression, which is regularly reviewed and is of appropriate compression to counterbalance the filtration of lymph. Of course, there are many other components of lymphedema management, but for successful treatment, we need to make sure that you take control of your lymphedema and you do not allow it to take control of you. The caveat to that is that I understand that this is not always easy to do.